Welcome to the Healthcare Technology Report, a leading information source on healthcare technology companies and solutions. In this episode, we speak with Mike Alvarez, CEO and President of Glooko, a digital health company that connects people with diabetes to their care teams through a unified data platform. By syncing with more than 200 devices and integrating directly into electronic health records, Glooko simplifies data management, enables remote patient monitoring, and strengthens collaboration between patients, providers, and caregivers. Today, the platform supports over 4.4 million users in 30 countries. Mike became CEO in 2024 after leading Qardio, a remote patient monitoring company. He previously held senior leadership roles at Medtronic, Jude Medical, and Novo Nordisk. At Glooko, he is focused on scaling connected care solutions that improve outcomes and expand access worldwide. I'm your host, RJ Lumba. We hope you enjoy the show. If you like the episode, click to follow. Mike, great to be with you today. Thanks for taking the time.
Hey, thank you, RJ. It's a pleasure to be here.
So I see that you spent a little bit of time in my neck of the woods, which is Princeton, New Jersey, or at least you worked for a company in Princeton, New Jersey.
Spent a lot of time there, yes.
Maybe that's a good way to just start talking about your background. So I believe you were at Novo Nordisk at the time.
I was, yeah. Back when it was a very small company, by the way, less than 400 employees in the U.S. Now they're a massive organization in the U.S. So, but yeah, I've been in biotech, health tech, med tech, whatever we want to call it, for about the last 30 years. Worked for some pretty big names, mostly in the diabetes space, either with the drugs that are used for diabetics or with the technology that measures glucose or glycated hemoglobin, A1C, those kind of things. So worked for Abbott, worked for Roche, worked for Novo Nordisk before going to Medtronic, where I spent about 13 years before starting down this digital healthcare journey that we're on right now.
Yeah, like reading through your background is like the kind of all-stars of the, med tech pharma space, in terms of the caliber of the companies you worked at. What was it about those companies or this area of healthcare that kept you in it and kind of rising through the ranks?
For me, I always knew I wanted to be in healthcare. So I watched my grandparents and my parents struggle with two major diseases that were probably one was caused by the other. So diabetes and cardiovascular were two big diseases that run on both sides of my family. So I didn't think I was smart enough to be a doctor, but I knew that I wanted to be in health tech. So when I had the opportunity to start off, my first job was at Abbott selling diagnostic equipment to labs that measured for things like glycated hemoglobin. And for me, it was an opportunity to really go deep into one space. Doctors have to know basically a very large amount of information across a lot of diseases. For me, it was an opportunity to go in and be educational to the healthcare professionals about new technology and how it could benefit their patients and how it could benefit them. And that was really exciting for me. And like anything, if you enjoy what you do, you tend to be good at it. And I loved what I was doing. So I just put my head down and really worked hard, and people would come to me and say, "Hey, do you want this next job? Do you want this next job?" And I had never really intended to be the CEO of a company, much less a global company like Glooko, but opportunities would come knocking on your door. So I guess the moral of the story is you put your head down and you keep running fast, and you end up stepping into things that you didn't even know were there. And that's kind of been my journey here for the last 30 years.
So in the early 90s, when you started at Abbott, you had no idea you would eventually rise to CEO level.
Never did I think that would happen. As a matter of fact, I was a sales rep. I was interviewed. I was living in New Orleans. I was interviewed and told, "We have a position for you, but it's in Scottsdale, Arizona, and you need to be there in a couple of weeks." And I was like, I'd never been to Scottsdale. I had no idea what that was like, but I said, okay, let's go on this journey. I remember I arrived in Scottsdale in June of 1992. It was 120 degrees. Everything was brown. I'm like, what have I gotten myself into? And it was 1992, right in the midst of Hillary Care. I don't know if you guys remember that. There was a lot of uncertainty in healthcare at that time, which seems to have been a norm in the last 30 years. There's always uncertainty. So it's the one thing you can count on is things are going to change. I remember my job covered the whole state of Arizona, and they were in the midst of base closures. So I felt like all I was doing was picking up equipment, and because Air Force bases were closing, I'm like, man, did I get into the right industry or what? It was the greatest thing that ever happened to me. And they would always come to me and say, hey, we want you to move up to Chicago and be in marketing, do other things. And I'd be like, oh, let me have just one more year out in the field. And I just loved interacting with the customers. And it's been just a great journey. I never, ever, ever thought that I would end up where I am. I'm very lucky and blessed to have had this journey and been surrounded by a lot of good people along the way that have helped. So
I think your story is probably very encouraging to maybe younger folks that are entering the kind of health tech industry because it goes to show that someone will notice,
yes.
even in a big corporation, someone will notice if there is a performer, a high performer, even at the entry ranks or the early ranks. I'd like to switch into Medtronic because you were there for over a dozen years. And curious, did you learn leadership along the way? Was it intentional? Did you find that it came naturally? Because I guess by the time you left there, you probably had a lot of people under you.
I ended up running three really large businesses at Medtronic. So I ran the coronary renal denervation business, I ran the implantable loop recorder business, and I ran the PaceArt business, which is a digital healthcare platform very similar to Glooko, but specific to pacemakers and defibrillators. And, it's funny because I just finished giving a presentation here in front of a group of people, and I was talking with my wife. And she asked me, do you ever get nervous doing that? I said, every single time. It's normal to get nervous before you do. So I don't think there's anything that you can say people are born leaders. I don't believe anyone is born a certain way. I think that you're shaped by what it is that you want to accomplish in life and going out there and educating yourself. So, if you get nervous because you give presentations, maybe you go take a class. Like I took classes with Dale Carnegie. Early in my career, I took classes at Toastmasters. There's so many things that, you need to be in charge of your education. And of course, companies will also offer things. Companies that I worked at, they would offer leadership type of educational opportunities. Take advantage of those. But I tell people all the time, listen, the door is there. It's up to you to open it and walk through it. No one's going to pull you through the door. You need to, have the desire to do that on your own. And if you do, chances are you're going to do well.
Well, Dale Carnegie and Toastmasters relate more to public speaking, and that's an element of leadership, but there's other components to leadership. So, your ability, because obviously you need to have a presence, people have to want to follow you.
Mm-hmm.
And maybe there's something inherent in the way you are. I mean, I just noticed, speaking to you now, you're very approachable. You kind of engender this sentiment of, yeah, I'd like to spend time with this person. I'd like to get to know this person. So do you kind of like think about things intentionally as you're assuming a leadership position? I mean, it's a daily occurrence, right? You're a leader every day. So
Yeah. Well, I think you hit on something here, which is it is intentional, but you have to like what you do. And for me, because I love what I do and I love the space that I'm in, I'm constantly educating myself on what the competition is doing, what the industry is doing, what healthcare policy is affecting in our industry. All of these things determine what we end up doing as a company. And if you don't like doing that, you probably will not spend a lot of time doing it and you may not be as effective. So I think it really goes back to finding a position or a job that you enjoy first and foremost. And then it's not really, what's the old saying, if you find a job that you love, you'll never work a day in your life. So I guess I've been lucky in the sense that every one of the jobs that I've had, I really like what I do. And I always share with people, if you ever come across a situation where you have a boss that you don't get along with, don't quit because of that boss, because good bosses come and go, bad bosses come and go. Wait it out. If you like what you're doing, stick it out and, keep doing a good job. So that's the only time that people, I think, really make mistakes is maybe they don't get along with their boss and they decide to do something else. They really need to look at themselves in the mirror and make sure that they're doing the best job that they can do, that they enjoy what they're doing, and things will work themselves out.
Now, how did you arrive at the Glooko opportunity and decide to kind of take the helm there?
Crazy story. So I was at Medtronic, as you said, for about a dozen years. And I constantly got phone calls. Hey, do you want to come here? Do you want to come there? And I was like, no, I'm going to retire at Medtronic. I'm never leaving. And then the pandemic hit, and I lived right outside of New York City in Connecticut. And of course, that was ground zero during the pandemic. And we were seeing, friends of ours passing away, young, healthy people being affected by COVID. And running the coronary business, and I was looking at our numbers going down because people were afraid to go into the clinics. They were afraid to go into the emergency rooms. People were literally dying at home during the pandemic because they were just afraid, rightfully so. And I thought there's got to be something that we can do. And I had an opportunity to get into the remote patient monitoring business, which I did because I felt that it was the right thing to help people at the right time. And that led to Glooko. So when Glooko called me, they were looking for a new leader that had experience in digital healthcare, in medtech, and in diabetes. So I was kind of a little bit of a unicorn for them. There aren't too many people like that, and was able to share what my vision of Glooko should look like. The board really rallied behind it, and because I really had no intention of making any additional changes. But when I looked at the Glooko platform and I looked at the unmet need, I thought, wow, this could really be something big. And after 1 year, I can tell you, we just announced a big acquisition. We continue to get deeper and deeper into the diabetes ecosystem. And yeah, it's just been a lot of fun. And I think it's going to continue to be a very successful place for us.
And for the benefit of our audience, I'd like to kind of go further into what Glooko provides because it's a platform that is adaptable to any device out there, which makes it unique as compared to how other devices have to be solely synced with one kind of platform.
Yeah. So, I shared with you that when I was at Medtronic, we had a similar platform called PaceArt. So what PaceArt did was it kind of took the information from the 5 big manufacturers of pacemakers and defibrillators and presented it all in one platform. At Glooko is similar in the sense that we take all the information from the manufacturers and present it on one platform. The difference is in diabetes, there's almost 300 manufacturers out there, people that make pumps, patches, glucose monitors, BGM, CGM, smart pens. And what ends up happening for the physician and their staff is when that patient comes in, they want to have access to their data. Well, you can imagine on your laptop having 200 different platforms that you have to access for that data. That's number one. Number two, I don't know if you've ever rented a car and it's a different model than what you drive every day. And you go to turn the windshield wipers on and it's like, oh, wait, where is it? It's on this side, it's on that side. So what that does for the healthcare professional is it creates a little bit of clinical burnout if they have to look at 200 different platforms and switch constantly. And the issue is consumers have choice. So not everyone is going to have the same device. So you have to be prepared to look at all these different platforms. What Glooko does is we're device agnostic. We aggregate all that data onto one platform. So the physician goes one place and he sees the data in the same spot every time. Mm-hmm. And this is important, especially in the US, because when you look at the healthcare professional landscape, we only have about 8,000 endocrinologists in the US. We probably need closer to 20,000. So we are way understaffed with the specialty side. When you look at the nurses that really support this, the diabetes nurse educators and the staff in the clinic, we're probably the same numbers, probably about 20,000 understaffed. And people get burnt out and they leave the industry. And this is just one other way to prevent that. That's number one. Number two, the other thing that happens is if you don't have access to the data, you end up writing it down. If you write it down, you're open to medical errors, or you just don't jot it down because you have so much work. So we improve efficiency, we reduce errors, and we reduce clinical burnout. And that's the premise of solving for this, what I call the Tower of Babel. You have 300 devices. We try to bring it all into one platform for the healthcare professional and for the patient as well.
Hmm. It seems like a no-brainer for someone to use. I'm not trying to plug your product, but it's like, what other alternative is there? I mean, why wouldn't you use a one unified system?
Exactly. And I think that's why when you look at our business, we really have three businesses. So we work with our device partners who come onto our platform. We work with the clinics and the hospitals who use our platform. And then we work with life science companies who are looking to find patients to enroll in clinical trials. So when you look at us, we have 10,000 clinics in 35 countries, over 4 million patients, 22 different languages. So it is kind of a no-brainer. And I would say we're probably 90% penetrated in the US in those clinics. Where we're going to now is into the enterprise level in the hospitals because we integrate seamlessly with the EMRs, the EHRs like Epic and Oracle. So we make it even more seamless and more efficient to work with us. So yeah, we think it's a no-brainer too. So, I think it's a good spot. It's a good business model, growing double digits. Sadly, we have more and more type 2 diabetics that are coming into the system. So a bigger need, especially like down at the primary care level. As long as we make it easy, I think you're right. It is a no-brainer.
So the top line growth, what's really going to move the needle from what I'm hearing is entry into more of the hospitals. And then secondly, the providing the data to life sciences companies.
Well, actually, for us, you're right. So it's the hospitals, and then it's the primary care business, which is the type twos that are going into primary care. And a lot of these in the US, a lot of those clinics are owned by the hospitals, so that's the synergy there. And then, these life science companies, when you think about it, they're looking to find the right patients to enroll quickly so that they can get their trials up and running as fast as possible. That's super important because you can spend a year just identifying the right patients. Well, if you're running a study where you need to look at glucose measurements, then this is a great place for us to be able to say, here's a data set of patients that will help you activate your study quicker, with the right patient set. So there's where that value comes from. So those are the three big drivers for us. We have natural tailwinds in the sense that type 2 diabetes is growing double digits. Type 1 diabetes is always growing right beneath double digits, right around 9%. So just by its very nature, that business continues to grow with some very healthy tailwinds. But the big driver, and the reason that we're growing multiples of that, is that efficiency and just getting things done quicker is very important in American healthcare. You got to do more with less people in the American healthcare system. So when you have a product that improves outcomes and lowers costs, once again, no brainer. And that's where we believe that we sit.
Mhm. What's the vision for Glooko as a company? Do you have your sights on going public? You've got a lot of capital that you brought in.
Mhm. Well, so we did a $100 million raise back in October, and we told the market, we were going to do some internal growth initiatives with that money as well as target some acquisitions. We just announced the first big target, which is an inpatient insulin dosing company called Monarch Medical Technologies. Monarch has been around for almost 2 decades, and they have a best-in-class AI-driven algorithm that really supports patients in the critical care setting. When you think about the US market alone, about 7 million patients are admitted to the hospital. 30 to 40% of those patients are going to require insulin while they're in the hospital. So a couple of million people need this. The CMS has come out with guidelines that hospitals need to show they have an electronic quality measuring management system for reporting adverse events associated with insulin. And that's what Monarch solves for. And when you look at Glooko, we've been primarily an outpatient-focused platform. Monarch is an inpatient-focused platform. So the synergy between the two are massive. So we did a lot of pre-work before we acquired Monarch And the KOLs told us, listen, if you can show the journey of that patient while they're inpatient and then manage them during the discharge until they see their physician, which sometimes in the US could take 8-10 weeks before you see your specialist, that's massively beneficial. So it's the entire continuum of care of that patient that the physician can look at and determine what the best healthcare plan of action is going to be for that patient. That's what this merger will solve for. We'll be the only company in the world that does that. So right now, we're working on the integration user interface platforms that help that journey that will launch here in the first quarter of 2026. So we're very excited about this because it's really going to do two things. It's going to improve healthcare for those patients, and it's going to reduce costs for the healthcare system. And we think that's just a no-brainer.
We're entering the tail end of the conversation. I have two final questions. One is, can you tell us about a person who's had a profound influence on you?
My dad was an immigrant to this country. He came to this country with two small children. I was one of them, and an 8-month pregnant wife, from Cuba during the Castro exodus of people. He was one of them. And he went from Havana to Chicago in January of 1966. So you can imagine going from a silk sweater weather in Havana to 10 below zero in Chicago. And my dad was an engineer. He worked for the U.S. Navy in Guantanamo, and he got to Chicago and worked for a big company called Parker Hannifin in their hydraulics division. But his dream was to be an entrepreneur, and he wanted to own his own company. So he moved to New Orleans, right time, right place, opened up a manufacturing facility in the oil business and became super successful during the oil boom in the 70s and early 80s, and lived the American dream and showed me that anything is possible. When I think of, would I leave this country and move to a country that I don't speak the language, let's say China, with a wife and 2 kids and a pregnant wife, that's just like so daunting to think of. Of course, I don't know that I ever would, and to think that he did. So he's my biggest hero in my life and my biggest role model.
Last question. Can you tell us about a charity, cause, or other endeavor that you're passionate about?
Well, I will share a personal story that I have a autistic son, and I am very, very involved in the autism community, looking for a cure for people who live with autism. And there's so many different types of autism in the world that we really don't understand the causes and how to interact with people with autism. And I would ask people to be thoughtful as you run into, it seems like we have more and more people with autism. And right now in the news, people are talking about it a lot. But it is a personal thing for me. I take it very seriously, and I hope that we find a solution, a charitable solution for all people that live with autism in the U.S. and around the world.
Well, Mike, I want to thank you again for taking the time. It's been a wonderful conversation.
Thank you for inviting me. This was a pleasure. Thank you.